Right. We got to go out to the hotline because on the hotline, we have a global health advocate. She's also the host of a reality TV podcast called Is This Real Life, which is better than this show, I would guess. But she's a global health advocate, smart cookie, great follow on Twitter. My good friend, Mandy Slutsker. Mandy, are you on the line there?
I think I am.
Oh, you are. We hear you. Yeah.
Yes. Technology
Welcome
wins today.
Yeah, well, it's kept us all going, I guess, right?
Right.
No, you sound fabulous. Dan, take notes.
Yeah, I'm well, Dan is on I think he's on a can of cream corn that he emptied out with a string that's connected to the cable company. So Mandy, we got about 15 minutes. First of all, you told me you got some cool stuff going on. Tell me a little about you and what you have going on in the middle of all this.
So I work in global health for a medical organization who I will not name because I have not gotten approval to speak.
Oh, so fine, totally fine.
I've worked in global health for about 13 years. I started at the NIH for about 3 years working in actually with biocontainment for laboratories. This was an interesting job out of college. And then lived in Bangladesh for a little bit.
Wow.
My master's in public health, focusing on epidemiology, specifically infectious disease epidemiology. And then have been working on doing mainly advocacy with the U.S. government and other governments to get them to invest more resources in health for the last probably decade or so. So this has been a very interesting time. Because a lot of us had been worried about something like this happening, I would say maybe 12 years ago, 13 years ago, people really started talking about what if there's a new novel influenza, similar to the swine flu. And then when H1N1 happened and it wasn't as severe as would have been predicted, I think a lot of people got comfortable and we're like, okay,
sure.
We had our 1 in 100-year thing happen, and
right.
I always was like, I don't know, I feel like that wasn't it. That wasn't the one, So I feel like it caught us slightly unprepared because just like insurance, you never really want to use it, and investing in health is something that I think a lot of people, especially in like a public health system and global health, is something that's just not a priority for most politicians because it's not something they can brag about to voters.
Is it a lot of people putting their head in the sand and sort of, ignoring it? Maybe it never happens.
Yeah, I think like everyone, this is something you hear about. One of the other things that keeps me up at night besides a massive pandemic is antibiotic resistance. Like at some point antibiotics are going to stop working.
Right.
And I don't think people are paying attention to that either. And you hear about articles here and, 60 minutes thing here and there, but until it really impacts your life, people don't pay a lot of attention, whether that is just your average day American or a policymaker.
Mandy, I'm going to go down a rabbit hole here real quick. Why do you think there's this every 100-year pandemic? What is the trend that causes this like almost clockwork pandemic to hit the world?
I'm not entirely sure what causes it. It's this kind of a thing is more of a 1 in 100 year. I think there's a lot of other types of epidemics that have happened that have been stopped from becoming pandemics. I think the reason this one wasn't is because it's respiratory, so it's really, really hard to stop, and because there's so many asymptomatic carriers. But yeah, I don't really know exactly what causes it. I think there's going to be more in the future, particularly because of people now live in closer contact with animals than they used to, especially with like growing populations. People are starting to live in areas that used to be only wildlife, and now people are just in closer contact, and so there's more zoonotic diseases like transmission between humans to animals.
You don't see that. You don't think that every 100-year kind of coincidence, or you think it is just a coincidence. You don't think there's any fact base that 1920, 1820, 2020 we're seeing a consistent trend.
Not really, no.
You are the expert.
Let me ask you a question.
I'm not a total expert. I just I'm not sure why it happened.
Well, you're smarter than we are.
Not at others.
So. Yeah, you're certainly smarter than we are.
Let me ask you this. in terms of, just because our time is short, I want to sort of get some focus out of you in terms of like, where do you think we're headed in the next sort of 8 to 12 weeks?
I wish I knew. I feel like I know where I think we should be headed, but unfortunately I don't know if we're headed there. Where I think we should be headed is focusing on increasing testing, specifically to know who has the illness. And then I know the FDA is working really hard to get antibody testing, but right now I don't think there's anything on the market that is accurate enough to be able to let people know whether or not they've been sickened with COVID before. So I think the thing that really needs to focus is on investing in testing and contact tracing, and that will help us move forward. I thought that the sort of lockdown situation was just to buy us time, not to be forever. And I feel like we haven't, unfortunately, used that time to do everything possible to get the PPE needed to both first responders and to businesses that will eventually reopen, and also to get all of the testing and contact tracing. We need an army of contact tracers. I mean, that's how most infectious diseases in the U.S. are kind of kept under control, is because you don't hear about them as much. I, unfortunately, was sickened when traveling in South Africa and came back and tested positive for Campylobacter, which is a mandatory reportable illness. And because my laboratory test was positive, I was tracked by the D.C. Department of Health for like 2 months.
Wow.
Kept calling me.
Wow.
And, making sure I wasn't going to public pools, that I didn't work with children, that I wasn't working in the food industry. And, of course, my infection had cleared up by that point. And, but that's an example of the fact that we do have people that do this work. We just need a lot more of them.
So, obviously where I'm coming from. I think that this has a shelf life of a few more weeks, tops, and then we're going to have to start to let people out. You think that there's going to be a disaster when that happens?
Yeah, tell Barry he's an idiot.
Unfortunately, I just don't think we have what we should have been doing for the last 5 weeks or 6 weeks or so, which is really ramping up testing, figuring out a national strategy. So, like, where do we not have enough reagents? Do we not have enough nasal swabs? Who's producing what? Can we use the Defense Production Act to force companies to start producing things that are needed? Where are there shortages? Where are there, overabundance of materials? How can we get them to where they're needed? And then, ramping up the ability to get funding to make sure that we can hire people to do contact tracing. And I feel like that's how you get your way out of this, because had we had better surveillance in the beginning, this would not have lasted so long. We would have figured out who was sick. We would have isolated them. We would have figured out who all their contacts were, but that just couldn't happen quick enough. We also didn't know how infectious this was.
So Mandy, New York here, Cuomo has already started antibody testing in the state of New York on a very small scale. How big does that need to get to before you feel confident taking opening the valve, if you will, as Cuomo would say? How many people have to have antibody tests? What percent of the population do we have to get to feel safe?
I'm not entirely sure what would target herd immunity. I mean, I'm guessing like at least 50% or more in order to get it to be. I mean, so most herd immunity for vaccines is around 95%. So when you start to drop below that for measles, you see kids starting to get measles. There was a measles outbreak a few years ago in Disneyland. And so I'm not sure. If more than half the people have antibodies, the chance of it continuing to spread so fast would go down. But I don't know the exact amount.
Can I ask, is that movie Contagion accurate? Should we all be afraid? Could that happen? Have you seen that movie? Has everybody seen that movie with Matt Damon?
Yes, that actually is probably the only accurate movie about a pandemic that exists.
Yeah, not the movie Outbreak. That's garbage. The Contagion that's a good movie, and everybody should watch that in the sense of this could happen at some point, right?
Yeah, I remember watching it, and I knew some of the people who were experts to advise on the movie. And there was only one thing I saw that was inaccurate, which is there was a scene, and I think I've only seen this movie once, but there was a scene in which someone went into a laboratory by themselves. And that's actually not allowed in those BSL-4 labs.
Oh, right, the guy in San Francisco. Right, the San Francisco guy goes and does whatever he does.
Yeah, I think so. Yeah,
what's interesting about that film is that it's a
like,
coronavirus, too, right? It's a novel coronavirus in that film as well. Also coming from a bat and a pig virus. Is this sort of...
Yeah.
Not to put you on the spot. You're not a film critic. I'm just saying.
I think it's pretty accurate. And then what's funny is, so my colleagues that used to do like all this lab stuff, we used to watch Outbreak once a year together and play a drinking game where we would drink whenever something was inaccurate, and we would like state like where, like which specific like biosafety manual, like, and it was like this whole thing like drink, and then it was like, you know,
drink,
rule number 10, page like 29.
It's like you got to drink every time during a task force update that somebody's called a third-rate reporter. It's like that.
Yep.
All right, hey, we got real quick, Kim. We got about a minute left for this. Go ahead.
Minute left. Tell Barry that he needs to wear a mask every time he goes outside.
I mean, if everyone were to wear a mask, it would help the spread because we just don't know who's sick and who's not, and so it just makes it so that like your particles don't get out there to other people.
Yeah, I don't want your particles around. I don't want your particles anywhere near me.
My particles are fine. My particles are not the problem.
Mandy, real quick here. What's is there a worry about false sense of security from wearing a mask?
Yeah, I mean, that's, I think, why they didn't want people to wear them in the first place, both for a false sense of security and that people would hoard the masks that are needed, the N95s that are needed for the healthcare workforce, more so than, you know, just your general person going to walk their dog. So, you shouldn't have a false sense of security. You can still get sick from wearing a mask. I view it more as like helping others and not infecting others than it is about protecting yourself.
Yeah. Gotcha. Hey, Mandy, we're coming up on the end of this. So just real quick, where can people find you if they're interested in your podcast and your insights on Twitter?
Yeah, so I'm on Twitter at Mandy Slutsker. That's Slutsker. And my podcast can be found anywhere that you can listen to podcasts, especially Apple Podcasts and Stitcher and all those places. And that's Is This Real Life with Mandy Slutsker. If you are a fan of The Real Housewives or basically any Bravo shows, you should definitely follow me.
Oh, that's our wheelhouse.
That. I'm telling you, if you go back and watch this week's Real Housewives of New York, I guarantee you will enjoy it. Guarantee. I'd be willing to bet money.
It
the women
hey, Mandy,
jump in the pool and are hilarious.
All right. Hey, listen, thank you. I hope we can do this again. I appreciate the perspective. Awesome to talk to you. All right, cool. You be well.